So what are cataracts? A cataract is a progressive, painless, cloudy of the natural internal lens of the eye. Cataracts block light, making it difficult to see clearly. Over an extended period of time, cataract can cause blindness. They are often related to growing older, but sometimes they can develop in younger people. How cataract affect your visions? So in a normal eye, light enters and passes through the lens. The lens focuses that light into a sharp image on the retina, which relays message through the optic nerve to the brain. If the lens is cloudy from a cataract, the image you see will be blurry. Other eye conditions such as myopia cause blurry visions too, but cataracts produce some distinct signs and symptoms. Blurry vision at any distance is the most common symptoms of cataracts. Your view may look foggy, filmy, or cloudy. Over time, as the cataracts get worse, less light reaches the retina. People with cataracts may have an especially hard time seeing and driving at night. Another early symptoms of cataracts is glare or sensitivity to light. You may be you may have trouble seeing in bright sunlight. Indoor lights that once don't bother you now may seem too bright or have halos. Driving at night may become a problem because of the glare caused by street lights and oncoming headlights. Sometimes cataract can cause double visions, also known as diplopia. When you look with one eye, this is different than the double visions that comes from the eyes not lining up properly, which would give you double vision when looking out of both eyes together. With cataracts, images can appear double even with just one eye open. Cataracts can affect your color visions, making some hues look faded. Your vision may gradually take on a brownish or yellowish tinge. At first, you may not notice these discolorations, but over time, it may make it harder to distinguish blues and purple. Sometimes a cataract may temporarily improve a person's ability to see close up because the cataract acts as a stronger lens. This phenomenon is called second sight because people who may have once needed reading glasses find that they don't need them anymore. As the cataract worsens, however, this goes away and vision worsens again. Frequent changes to your eyeglasses or contact lens prescriptions can be a sign of cataracts. This is because cataracts are usually progressive, meaning they get worse over time. Now, the majority of cataracts are related to aging. More than half of people over 65 have cataracts. Babies are sometimes born with cataracts, also called congenital cataracts, or children may develop them as a result of injury or illness. Exposure to ultraviolet light can also increase the risk of cataracts and other eye conditions. Now, the exact cause of cataract is unknown. While the risks grow as you get older, these factors may also contribute, like diabetes, smoking, excessive alcohol use, eye injury, prolonged use of corticosteroids, prolonged exposure to sunlight or radiation. How are cataracts diagnosed? Most cataracts can be diagnosed with an eye exam. Your eye doctor will test your vision and examine your eyes with a slit lamp microscope to look for problems with the lens and other parts of the eye. The pupils are dilated to better examine the back of the eye where the retina and optic nerve lie. Now, there are two main types of cataract surgery. The more common type is called phaco emulsification or phaco or ultrasonics. The doctor makes a tiny incision in the eye and breaks up the lens using ultrasonic waves. The lens is removed and an intraocular lens or IOL is put in its place. In most modern cataract surgery, the IOL eliminates the need for thick glasses or a contact lens after surgery. Alright, so for a few days, your eyes may be itchy and sensitive to light. You may be prescribed drops to aid healings and asked to wear an eye shield or glasses for protection. It takes about 8 weeks for your eyes to heal completely, though your vision should begin to improve soon after surgery. You may still need glasses, at least occasionally, for distance or reading, as well as new prescriptions after healing is complete. Should you have cataract surgery? Whether or not to have cataract surgery is up to you and your doctor. Rarely, cataracts need to be removed right away, but this isn't usually the case. Cataracts affect vision slowly over time, so many people wait to have surgery until glasses or contact lenses no longer improve their vision enough. If you don't feel that your cataracts are causing problems in your day-to-day life, you may choose to wait. Alright. Tips to prevent cataracts. Things you can do that may lower your risk of developing cataracts. Don't smoke. Always wear a hat and sunglasses in the sun. Keep diabetes well controlled and limit alcohol consumptions.